Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today we're going to talk about Nifedipine, an important medicine for treating high blood pressure and chest pain. We'll break down everything you need to know about how and when to take it. First things first, what is Nifedipine? It's a medicine mainly used for two things: high blood pressure, which means your blood pressure is too high, and angina, which is chest pain that happens when your heart doesn't get enough oxygen. If you have either of these conditions, your doctor might have prescribed Nifedipine for you. So how does it work? Nifedipine belongs to a group of medicines called calcium channel block. Basically, it relaxes your blood vessels so blood can flow more easily. This lowers the pressure in your arteries and helps more oxygen reach your heart. Now let's talk about how to take it. Usually the starting dose for adults is 10 milligrams mg 3 times a day, but this can change depending on how your body reacts to the medicine and what your doctor tells you. It's super important to take it exactly as prescribed and not change the dose without talking to your doctor first. Like all medicines, Nifedipine can have side effects. Some of the most common ones are dizziness, skin flushing, and headaches. If you experience any serious side effects, like difficulty breathing or swelling, get medical help right away. It's also important to avoid grapefruit because it can interact with the medication. To sum it up, Nifedipine is a really helpful tool for managing high blood pressure and angina. Don't forget to follow your doctor's instructions and pay attention to any changes in your health. Thanks for watching this video, and don't forget to take care of your health. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.